In this clinical exercise, rubber dam is to be placed on the 3/6 in preparation for the placement of a fissure sealant. The technique demonstrated for this procedure is clamp placement prior to rubber dam. Step 1 is to prepare the rubber dam equipment. A list of this equipment can be found in Minimal Intervention Manual. Step 2 is to assess the tooth to be clamped, noting its size and shape and stage of eruption. This assessment will influence the position of the punch hole in the rubber dam and also the choice of clamp to be used. The tooth is visually assessed and the proximal contacts are flossed to check for tightness and to remove any debris which may be present. When working in the mandibular arch, the patient's upper body is raised slightly from the full supine position and the chin tucked slightly into the chest. The occlusal surfaces of the mandibular teeth will then be parallel to the floor when the mouth is open. The overhead light should be directed from a more vertical angle to ensure appropriate lighting. Step 3. Prepare the rubber dam by punching a locating hole in one corner. In this instance, the locating hole is on the patient's left and is positioned in the top left corner of the rubber dam sheet. The locating hole helps the operator orientate the dam in the patient's mouth and also allows the assistant to orientate the dam for the frame placement. A large single hole is punched for the isolation of the 3/6. A large hole is chosen to accommodate being stretched over the bowl of the molar clamp, and because the molar itself is the largest tooth in the mouth. A small amount of water-based lubricant is applied over the hole on the underside or inferior side of the dam. The lubricant allows the dam to glide more easily over the tooth surface. With the presence of saliva and pellicle, the lubricant is generally not necessary. The rubber dam is now ready for placement. Step 4. After selecting the appropriate wingless molar clamp, a length of floss is tied to both jaws and the ball of the clamp. It is important to secure the clamp in this way to enable the safe retrieval of the clamp should it become dislodged or dropped, and therefore place the patient at risk for swallowing or inhaling the object. With constant use and/or misuse of clamps, metal fatigue occurs and clamps have been known to fracture. The floss should be long enough to be grasped quickly should the need arise. The clamp is now tried on the tooth by picking it up using the forceps. A small amount of tension is applied to the jaws, allowing them to spread sufficiently so that the clamp is able to pass over the crown of the tooth. Once past the maximum convexity, the tension on the forceps is reduced so that the clamp is in contact with the 3/6. One side of the clamp is gently seated first so that the jaws are sitting at or just above the gingival margin, and then the other side is seated. The clamp is then released gently, ensuring that it is not impinging on the gingival tissues and that the clamp is stable with a 4-point contact. The forceps are removed and set aside. A hand mirror can be used to check the position. Another way to check for the stability of the clamp is to use your fingers. In some instances, other clamps are tried in order to obtain the best fit around the tooth. The safety floss should be pulled toward the buccal away from the patient's mouth. Step 6. Apply the dam. The safety floss is fed through the hole in the rubber dam sheet. The hole in the rubber dam is then stretched over the bowl and under the jaw of the clamp, exposing the tooth. At times, the rubber dam may become caught on the tooth distal to the clamp tooth, leaving it partly exposed. If this happens, the dam will need to be manipulated to cover the 3/7. Step 7. The rubber dam is attached to the frame. The sequence recommended for this procedure is described in the diagram. It is important to keep the frame steady so as not to cause unnecessary discomfort to the patient's face. The rubber dam is lifted over the 3/7 by using a blunt instrument. Step 8. With dental floss, the rubber dam is fed through the mesial contact of the 3/6, taking care not to perforate the rubber dam. The floss can be removed by sliding it out toward the buccal rather than toward the occlusal. At times, the dam can lift out if the floss is removed in the occlusal direction. The isolation of the 3/6 is now complete and ready for the fissure sealant placement. Following the completion of a single tooth isolation procedure, the clamp is removed, followed by the frame and rubber dam together. It is important to check that no pieces of dam are left behind after removal. Many dental procedures require the use of rubber dam for optimum moisture control, including resin-based restorations, fissure sealants, and endodontic treatment.